everyone! Welcome back to Shalonda's Nursing Corner. If you're new here, I'm a registered nurse, and this is part 3 of our pharmacology series. So far, we've covered part 1, pharmacokinetics, pharmacodynamics, and the rights of medication administration. Part 2, drug classifications and the most common medication types nurses need to know. Now it's time for part 3, where we focus on medication safety and nursing interventions, because knowing the meds is one thing, but safely administering them is what really matters. Stick around because I have a quick quiz at the end to test your knowledge. Let's jump in! Some medications have a higher risk of causing serious harm if given incorrectly. These are called high alert medications, and they require extra caution when administering. Here are some examples. Insulin can cause life-threatening hypoglycemia if overdosed. Always double-check the dose. Anticoagulants warfarin, heparin, too much. Bleeding risk, too little. Blood clot risk. Monitor lab values like PTI and NR for warfarin and a PTT for heparin. Opioids, morphine, oxycodone, fentanyl can cause respiratory depression. Always assess RR respiratory rate before giving. Potassium IVKCI can stop the heart if given too fast. Always use a pump, never push IV potassium. Medication errors are one of the biggest safety risks in nursing, but the good news, most of them are preventable. Here's how to avoid the most common mistakes. Wrong dose. Always double-check calculations and use 2 nurses for high-risk meds like insulin or heparin. Wrong patient. Never assume. Always use 2 identifiers like name and date of birth. Wrong route, POIVIM, sub-Q. Make sure you're following the correct order and guidelines. Wrong time, some meds need to be given on time like antibiotics or insulin. Set reminders if needed. Now let's talk about what nurses must do before, during, and after giving meds to keep patients safe. Before giving meds, check vitals and labs. Is BP too low for antihypertensives? Is potassium low before giving Lasix? Ask about allergies. Educate the patient, tell them what they're taking and why. During medication administration, follow the 6 rights: right patient, right drug, right dose, right route, right time, right documentation. For IV meds, monitor for reactions like redness, swelling, or allergic responses. After giving meds, assess effectiveness. Did the pain med work? Is BP improving? Watch for side effects. Did an opioid cause respiratory depression? Did an antibiotic cause diarrhea? Document everything. If it's not documented, it didn't happen. Even with careful monitoring, sometimes patients have adverse drug reactions, ADRs. As nurses, we need to recognize them fast. Here are 3 major ones to watch for. Allergic reactions: rash, itching, swelling, trouble breathing. Anaphylaxis is an emergency. Toxicity, too much drug in the body. Example, digoxin toxicity causes nausea, vision changes, and arrhythmias. Idiosyncratic reactions, unexpected responses. Example, a patient taking Benadryl and instead of getting sleepy, they become hyperactive. Nursing action, if you suspect a reaction, stop the medication, assess the patient, notify the provider, and document. Time to test what you've learned. I'll ask a few questions and you'll have a few seconds to think before I reveal the answer. Question 1. What type of medication requires checking PT-INR levels before administration? Answer. Warfarin, an anticoagulant. Question 2. What should you check before giving beta blockers like metoprolol? Answer. Blood pressure and heart rate. If HR is below 60 BPM, hold the med and call the provider. Question 3. Why should IV potassium KCl never be given as a rapid IV push? Answer. It can cause fatal cardiac arrest. Always use a pump. Question 4. A patient on morphine has a respiratory rate of 8 breaths per minute. What do you do? Answer: hold the morphine, assess the patient, and administer Narcan if needed. And that's a wrap for part 3 of our pharmacology series. We covered high alert meds and safety tips, common medication errors, and how to avoid them, nursing interventions before, during, and after giving meds, how to recognize and respond to adverse drug reactions. In part 4, we'll talk about medication calculations and dosage conversions, a crucial skill for every nurse. If you found this helpful, don't forget to like this video and subscribe so you don't miss the next one. Thanks for watching Shalonda's Nursing Corner. See you next time.